Thanks so much for recording this with us, Jan.
Pleasure.
If you could share a little bit about yourself, a bit about your family and your hobbies and what you enjoy doing,
Right.
that would be fab.
Well, I'm an 85-year-old grandmother, 4 children. Prior to my legs being injured, I enjoyed going to exercise classes twice a week, a lot of walking. I'm volunteer for an organisation here, which I enjoy doing. And the usual enjoyments, theatre and socialising, going out for morning and afternoon tea, etc. Yes, that's me.
Fab, thank you. So if you can tell me a little bit about when you first got your wound and what caused it.
Right. It was 16 months ago, and I was on a treadmill, which I've used many times, and I thought that's enough, finish. And thinking I was knowing what I was doing, which I thought I did, I turned it off, but I'd actually turned it right up, and I couldn't keep up with it. I couldn't get back to it, and I didn't have a stop button, so I ended up going out backwards, and it took the skin off my shins. They insisted that I go to the hospital. They had one leg was stitched, the other was not so bad, but of course, frail skin, the stitching gave way, and it's taken many months for the shins to heal. My problem is not my shins anymore, it's the exudate that I've produced that have run down on both legs, and I have acquired many or large ulcers on my legs. So they've been my problem. The original injury is long gone. So very frustrating.
Thank you for sharing that. That's hard. So how did the wound affect your day? So, for example, sleep, interacting with family, doing your normal things, your normal hobbies, and going out and what have you?
Well, I had to stop exercise classes, and I was about to start aqua aerobics, but of course that was out. At that time I had a dog. I've had to put him down since. And of course I was trying to walk, but it was very difficult. I had a lot of pain. Sleeping, I had to have, ended up getting drugs to try and help me sleep for the pain. They were extremely painful, which I hadn't realised how much they would be. So yes, it disrupted my life quite a lot. Absolutely.
So before you had the DEBRICHEM treatment, what other kinds of treatments came first, and what did you see in terms of results?
I think the nursing staff, the district nurse, put every available wound dressing there is, and I didn't seem to react to any of them, so they change and etc. And then I spoke to my leg man, I can't think of the name, vascular surgeon, and I said, should I go to somebody else and try and get another opinion? And he said, yes, I think you should. So that's when I decided, well, he recommended me to go to Jana at RPA, and I was doing that for about probably 6 months, and then I was getting nowhere fast. 1 step forward and 3 back, and she suggested that I get another opinion, and I went to the command centre at RPA, and I began to started seeing Tom, who comes out to me once a week. During the week, if we need to, my daughter helps me change, because I can't quite see all the little bits and pieces that I need to apply the wounds. From there on, because my skin was getting more sensitive, we were putting pads over and holding them with plaster. And then where the plaster was, or the tape, I broke out there as well. So I had them on the back of my leg, on the sides. Very uncomfortable, very, very uncomfortable. And that's where Tom recommended that I try your product.
So what did Tom explain about DEBRICHEM and why you would be a good candidate for that? Can you remember?
I do remember him saying, and maybe this is not a good thing to say, he said, it's like an atomic bomb. He gets to it, cleans all that dead skin off, clears all the bacteria off, and gives it a chance to heal. I'd had some ointment that was very painful, so I was sort of ready for Bastix, I think it was called, for pain. And then I said, okay, let's try something, because I was really getting nowhere. And I went into RPA, into the rooms, and it was applied. It was very painful, but then it subsided after a while. And I honestly think that was the turning point from one step forward and 2 or 3 back. From there on in, it seemed to respond to the silver injections, silver dressings which were applied. And here I am today, nearly there. The left leg has a little tiny pinhole that doesn't want to give up. On the right leg, which is the big one, it is reduced dramatically. Still there, unfortunately. As far as the bacteria and the infections, I'm still getting staph infection probably every 3 weeks. And on last Tuesday, when I had them changed, the dressings changed, the nurse did say to me it was a bit green, suggesting another infection, or the dressing looked green. So I'm not out of the woods with that yet, but definitely it changed the direction of my healing. It was good.
Thanks, Jen. So this is a bit about what changed after. So I think you might have covered a bit of this, but so is there anything else that changed after the first treatment? You mentioned a change in the size, but things like your comfort level, movement, or wound appearance. Can you elaborate a bit more on those things? But your medications,
Yeah, I've tried not to take any, and I'm not on anything now. I still had to occasionally, I'd try and put up with it, get to bed, couldn't sleep, get up and take some, which made me very drowsy the next day. So I really hated taking it. When we took it home, when we took the dressings off, they really were horrible. Really, I could see my daughter's face all screwed up, but she was doing very well and helped me immensely. I guess it just slowly reduced. I don't have that huge exudate that was running everywhere, and the dressings couldn't contain it. It was my body trying to heal, I guess. But that has backed right off, and I can walk, I can go out. I do have to wear stockings, but support stockings, but I am much better. And hopefully 1 or 2 months and I'll be clear.
You may have answered this one already as well, but what you could do now that felt hard beforehand, earlier on when you had, before the DEBRICHEM treatment, what can you do now that you couldn't do before? I think you may have covered most of that.
Probably, but I think what I can say is to put my feet down of a morning before DEBRICHEM. The pain was, I had to sit there for a while when I got out of bed, for example, and just let the pain run away a little bit and then get up. That did go away. I still do sit up for a little minute and make sure that my legs are still there, and then I take off. So I think the pain definitely was reduced by having the DEBRICHEM.
Thank you. And looking at your journey so far, what's the biggest improvement since you've had the DEBRICHEM treatment?
Reduction in size, I think, of the wound. It was about half the size of the palm of my hand. It was quite deep, quite extensive. It now it's half the size, both vertically and horizontally, and just looks healthier, just looks better. And as I said, the left leg is nearly all gone. Yeah, so That's fine.
Fantastic. Okay. And is there anything else you'd like to add about the experience that you'd want to share with other people that may use DEBRICHEM?
Well, it's something you don't rush into. I must admit I did think about it for a little while. But it is painful initially, but I would recommend that you do it. It really changed the course of the healing of my legs. I honestly feel that.
Thanks, Jan.
Thank you, Catherine.